everyone, I am Dr. Santosh Kumar, Orthopaedic and Joint Replacement Surgeon based in Kolkata, and I head the Poorva International Orthopaedic Foundation. In our video series, we have been educating you about various orthopedic issues that are commonly faced, so that people who are having or any family members who are having these issues, we can have a basic understanding of the problem and we can seek the right treatment at the right place. And of course, one of the important message that I want to give you is that world-class orthopedic treatment is available in Kolkata, so please do come to Kolkata. Welcome to Kolkata, and you don't need to go to other places if you are especially residing in Bengal, because world-class orthopedic treatment is available right here in Kolkata at most affordable prices. The topic that I am going to discuss today is fracture neck femur. Well, fracture neck femur, as we understand that hip joint is the biggest bone in the body, and femur is, or the thigh bone, is joined with the pelvis with the hip joint, and this has got a ball which is known as the head of the femur, and it has got a neck, and this is the shaft of the femur. Neck femur fracture involves this neck, and that's a catastrophic fracture because that's a fracture of necessity wherein we have to treat it. We cannot neglect it, because neglected fracture can lead to complicated medical issues and can complicate the issues further. So we have to treat, we have to mobilize, we have to make the person stand, because life is movement and movement is life. We have to move the patient, we have to make him stand. That is the basic idea of treating fracture neck femur. And we need to understand that fracture neck femur is a fracture of insufficiency. You know, what it means is that it's an osteoporotic fracture. People with sufficient bone stock, young people, should not get this fracture. Mostly this fracture happens indoors because of slip in bathrooms or because of rotational twisting injuries to legs. So on one hand, we should treat osteoporosis, we should identify and treat osteoporosis before it causes fracture, insufficiency fractures or low velocity fractures. And on the other hand, we have to prevent falls. To prevent falls, we have to encourage our seniors to use a stick while walking. We have to put holding places in the bathrooms. We have to keep the bathrooms dry. We have to check their visions regularly so that they are seeing regularly. We have to keep the house well lighted. So these are the things we have to do to prevent fall, and we have to treat osteoporosis, because this is a fracture of insufficiency and low velocity fracture happens indoors. Now, to understand this, we have to see how many types of fractures are there. Fracture can be just inside the this fracture neck femur can be inside the joint, which is known as intracapsular fracture neck femur, or it can be outside the joint, which is known as extracapsular fracture neck femur. Now, this intracapsular fracture neck femur can itself be of three kinds. One which is just below the head, which is known as subcapital fracture. This is transcervical fracture, and this is basicervical fracture. So, the closer it is to head, that is subcapital fracture, lesser is the union chance, the chance to unite. And the farther it is from head, like the basicervical fracture, higher is the union chance, the chances to unite. Along with the position of the fracture, the other determinants which influence the healing of the joining of the fracture is the time that has elapsed since the fracture, the physiological age of the person, because the younger age it is likely to unite, older age it is likely may not unite. So all those factors have to be taken into consideration, and especially if we go for fixation, then time elapsed since the intracapsular fracture neck femur, time elapsed since the fracture is also very important. Now, the treatment of hip fractures can be percutaneous pinning, which is done in a microsurgical way through fluoroscopy guided, means there is a running X-ray in operation theatre which is known as SIAM. Seeing through that guide wires, we put pins. It can be partial hip replacement. Partial hip replacement is done wherein we don't expect the fracture to unite so easily and the person is not very active. Then we change the ball only and leave the cup. The person is not very active or medically not very fit. In that case, we do partial knee replacement. If a person had been fit and very active before surgery, before falling down, then we go for total hip replacement. And if the fracture is extracapsular, outside the capsule, then we go for intramedullary nailing or fixation devices which are known as proximal femoral nail, etc. So this is X-ray of a percutaneous pinning. If the fracture is inside the joint and the physiological age of the person is not very high, and we are able to treat the fracture within a sufficient time, then we try for fracture union, and this is through percutaneous pinning, fluoroscopy guided pinning techniques. This is a microsurgery. If the fracture is outside the joint, then we go for plate and screw fixation, which is known as DHS, dynamic hip screw, and presently more and more of proximal femoral nail, as we will see, is being used. And if the fracture is inside the joint there has been sufficient, a lot of time has been already wasted for the treatment, or the physiological age of the person is very high where fracture union is less likely, then we go for replacement of the ball. Now as discussed, this replacement of ball can be, this replacement of the hip joint can be only ball replacement or ball and cup both replacement. Only ball replacement is known as hemiarthroplasty. It is done in cases where we expect that the patient is not very active and the patient is physiologically not very fit for extensive surgery. Then we go for bipolar hemiarthroplasty or hemiarthroplasty. If the person is active and physiologically fit, then we have to go for total hip replacement in cases of fractured neck femur intracapsular. We have to undergo total hip replacement. Now in total hip replacement, both ball and cup are replaced, and it can be cemented or uncemented depending on the bone stock and the quality of the bone. And we have already discussed exhaustively in our earlier videos about total hip replacement, so we are not going to discuss it here. Another thing, if the fracture is extracapsular, that is outside the joint, then we try to fix it with fluoroscopy guided microsurgery techniques like percutaneous nail or proximal femoral nail. So this is the proximal femoral nail where we try to fix the fracture and make it unite. So once fixation techniques are used, the weight bearing can be delayed. If we may not be able to make the person walk from the very next day as compared to hip replacement, but all these techniques have their own indications, advantages and disadvantages, which need to be discussed with your treating doctor. So if you have any queries regarding fracture neck femur, please do write to me at my email ID santdr@gmail.com, or you can WhatsApp me at 9831911584. Thank you.